Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
Now, treatment of xerophthalmia. Okay, in the treatment of xerophthalmia, first we have local ocular therapy. Local ocular therapy. In the local ocular therapy, for the treatment of xerophthalmia, we can give topical artificial drops can be given. And if the patient has keratomalacia, then we should do the treatment like a corneal ulcer. We should take the treatment. Treat the patient like corneal ulcer. But what is important in the treatment of xerophthalmia is vitamin A therapy. In the vitamin A therapy, we give dosage. The oral dose of the drug is given. So actually, the oral dose of the drug is given at 0, 1 and 14 days. And for children less than 6 months of age, 50,000 international units of vitamin A is given in the oral dose at 0, 1 and 14 days. From 6 months to 1 year of age, we give 1 lakh international units. Oral dose is given at 0, 1 and 14 days. In more than 1 year of age child, we give oral dose is given in 2 lakhs international units. Oral dose on 0, 1, 14 days is given. And if you wanted to give IM dose, for IM dosage is equal to half of the oral dose. So if you half the oral dose, then that dose can be given as intramuscular injection. Then one more important thing is treatment of underlying conditions. Most of the times the vitamin A deficiency is associated with protein energy malnutrition, and it is associated with other nutritional disorders. Like we should treat other nutritional disorders, diarrhea, dehydration and electrolyte imbalance should be treated in the patient. Should be treated.
thank you and thank you for watching.